Can you get pregnant with PCOS? You absolutely can. You can thrive with PCOS. The only reason you believe you can't is because you're identifying with the condition. You are not polycystic ovarian syndrome. You are presenting with some of the symptoms that come together to form that condition. But as an acupuncturist, I've had many women who've been diagnosed with polycystic ovarian syndrome come to me, and when we work with their lifestyle and their belief systems, change their diet, implement an exercise plan that works for them, they absolutely thrive despite having PCOS. And they learn to really manage it and heal their bodies and supercharge their fertility and go on to have healthy pregnancies and healthy babies while maintaining their own health. Here's some keys to doing that. So just quickly, PCOS is a metabolic disorder with hormonal imbalances, and it's also referred to as an endocrine disorder. Most commonly seen is higher than normal androgen levels, androgen being testosterone and DHEA. There's also higher than normal insulin levels, often accompanied by insulin resistance. And as you probably noticed, if you have gotten off the birth control pill or have are trying to have a baby, that your periods probably have been irregular for a very long time. And sometimes you can have periods, cycles lasting longer than 35 days, or just, they're always oscillating, short cycles, long cycles. And if you started taking your basal body temperature or using an ovulation predictor kits, you might have noticed that there's months that you do not ovulate, and then difficulty getting pregnant, maybe maintaining a pregnancy. Skin problems are really common, excess facial hair or hair falling out. So whether you are dealing with, a couple of these or all of these conditions, you've been diagnosed with it, here's the key. Diet is the key, because as I mentioned before, the insulin resistance. So really to balance blood sugar. Now, to say that there's an ideal diet for PCOS, like a one-size-fits-all diet, there just isn't. There isn't for any condition. But what I found to be very effective is there's a book called Wheat Belly. It came out, I don't know, maybe 6-7 years ago. I recently, I've given it to so many of my patients, and it's incredible. I mean, the foundation of it is not just eliminating gluten, but eliminating all grains. That grains really spike blood sugar. A lot of legumes, and adding good proteins, good saturated fats to the diet to balance blood sugar and balance hormones is tremendously beneficial for PCOS. As Dr. Davis says, I recently interviewed him for my podcast, fertilityhour.com. He said he's lost count of the amount of women who have come, to be treated, because of fertility issues, who've become moms. I mean, so that's probably the best favor that you can do. I'm going to ask you to check out my podcast and listen to his interview. It'll be extremely impactful, and you'll get exactly what I'm talking about. Also, exercise. One size does not fit all. There's some women who do wonderfully in high impact type aerobic exercises with strength training. What comes to mind is like CrossFit or boot camps and things like that. And other women who have underlying endocrine, adrenal, maybe hypothyroid, who are just going to be really exhausted by those exercises. So you're going to have to kind of feel it out a little bit and see what works for you. Restorative yoga. If you're thinking, yeah, but I have, I've gained weight from this. Balancing blood sugar through eliminating grains, refined carbohydrates, sugars out of your diet. If you do that, and then you do like mild walking, and you really work on restoring those adrenals by getting plenty of good sleep, restoring bowel flora, gut flora, managing with, taking trace minerals and proper supplementation, you will manage your weight. it won't be a struggle anymore. I guarantee you. Because if you kind of ignore those steps and do high impact, you're going to exhaust yourself. I mean, that is if you have the underlying adrenal imbalances that many of us have. So anyways, you're here because you're motivated, and maybe you're a little bit scared because you want to start a family and you've had this diagnosis. Take a deep breath. It's going to be okay. You can actually thrive with being diagnosed with PCOS. You are not PCOS. You have these signs and symptoms. You can get them under control. And I wanted to invite you to download a free report. It's called How to Restore Your Fertility. It was written by my partner, Dr. Eva Keen, and it's wonderful for all of us who are wanting to balance our bodies to have a healthy baby. So I'm going to put the link below, and if you like my videos, then like, comment, and subscribe. Okay, thank you so much.